What specific factors or underlying conditions can cause jugular venous pressure distension without any noticeable pulsation? This JVP distension can either be unilateral, which is usually seen on the left side, or bilateral. Patients who have unilateral JVP distension, there are three main reasons for this. One is due to local obstruction, meaning we might have a blockage in the venous pathway on that same side. For example, in patients who develop thrombosis here, or it could be an infection or vegetation due to catheter infection. Second, there are patients who have intrathoracic masses. That is, patients who have a mass in their chest, whether in the mediastinum or at the apex of the lung, or a tumor that exerts pressure on the subclavian vein or the brachiocephalic vein, which leads to distension. And finally, there are patients who have a persistent left superior vena cava. During the early embryonic period of development, we typically observe the presence of two distinct superior vena cavas, or SVCs. Specifically, there is a right SVC and a left SVC. The left SVC in particular drains its blood directly into the right ventricle of the heart through a specialized vein known as the coronary sinus, which is essentially a small yet significant blood vessel. But at the end of the embryonic period, this left SVC disappears, and these vessels connect directly to the right SVC. Now, in patients who have a persistent left SVC and the left SVC remains, this causes the blood flow from the left subclavian and the left internal jugular vein to enter the right ventricle directly through a small vein called the coronary sinus. And because this vein is a small diameter vein, it cannot easily handle this volume of venous blood flow passing through it. And for this reason, we always see congestion and distension of the internal jugular and subclavian veins in these patients. If we have jugular vein distension without pulsation and it is bilateral, we call it SVC syndrome. In SVC syndrome, there is an obstruction in the SVC itself. Therefore, it causes all the proximal vessels to it, that is, the right and left subclavian and the right and left jugular veins, to become distended. This means that we actually see swelling in the head and face and in the arms. And as a result, this swelling leads to impaired venous drainage from the head and neck. These may put pressure on the airways, causing the patient to feel shortness of breath, have a cough, and their face may take on a cyanotic appearance. We call this SVC syndrome.